Looking at here is the larynx.
Okay.
And then extending from the larynx, you can see the C-shaped rings of cartilage stacked one on top of each other. This is the trachea, okay? And so sitting right on top of the larynx, if you go on the inside of the mouth and down far enough, you can see this little curled structure, and that would be the epiglottis. The epiglottis.
Yes.
That sits right on top of the larynx. And it's always easier to enter from the mouth region to see that as opposed to trying to cut in here.
Okay.
Okay, you also have these two glands that sit lateral to each other, lateral to the larynx. These are the salivary glands. Then, of course, you have the trachea, and then posterior to the trachea, this tube that is the point where food is being routed down to the stomach. That would be the esophagus, okay? Then this little structure, it's a gland, overlies the surface of the trachea.
You said the thyroid?
That's the thyroid gland, okay? And then, of course, you can see the common carotid as well as the vagus nerve.
Okay.
So there's the vagus, here's the common carotid. This would be the internal jugular, and you can just barely make out the external jugular that's coming off just outside of that, okay? And it's a little deeper.
Oh, I see
It's a
it.
little deeper.
So
But
you
it comes up at an oblique angle.
Will you point to those again? Internal?
Yeah, so internal jugular, external jugular.
Okay.
Okay? Now, all this blood is returning from the head, and eventually it will enter what is called the anterior vena cava. So that would be equivalent to the superior vena cava in humans.
Okay.
Then the inferior vena cava would be right there.
It's really big on this one.
Yeah, it's pretty good size, well injected. And then remember that little white thread that is running, let me see which one it is, I think it's this one. That white thread that's running down along the surface of
that the phrenic?
would be the phrenic nerve.
Okay.
And it would be innervating the diaphragm.
Okay.
So this is what conveys signals from the respiratory centers in the brain to the diaphragm to cause inspiration of air.
Okay.
You all right with this?
Yes, sir.
Okay, the heart itself, you can see right here the two upper chambers, which are the atria, so right and left. In between those would be
Pulmonary
the
trunk.
pulmonary trunk, and then directly posterior to it would be the aorta. And again, remember that aorta turns and goes downward, and you can see the extension of that downward projection. This would be, since it's in the thoracic region, we would call that the thoracic aorta. Now, there is a vessel that would come right alongside of it. It's a vein, and that's called the azygous vein. Now, in this one, it didn't get well injected.
Okay.
And then that little white thread that you can see lateral to
Chain ganglia.
is the sympathetic chain ganglia, and then you can also see the esophagus here.
Oh, okay.
So there's the esophagus that continues to extend down to the stomach,
Okay.
which would be just inferior to the diaphragm. So that big sac-like structure is the stomach. Here, this extension, this organ right here,
The spleen?
is the spleen. What's one of its major functions?
To get rid of the old red blood cells.
Right, to remove old red blood cells. And of course, if this is the stomach, this first part of the small intestine right there has to be the duodenum.
Yes.
Now, another reason you can know that is, here's the liver, right? This big organ.
Is that the hepatic portal?
Yeah, and if I can find it, yeah, right there.
The gallbladder?
There's the gallbladder. There's the cystic duct.
Okay.
And if you can follow it down, and I must admit, I'm having a hard time seeing it right there, but there should be a tube, the common bile duct, that will convey bile down into the duodenum.
Okay.
Okay?
And is this other thing right here, is that the hepatic?
Yeah, well, it would be going up into the liver.
Okay.
And so you'd have to find the point of merging,
Okay.
convergence between all three of those structures.
Would that be something that,
I typically don't ask
Okay, okay.
it's the common hepatic bile duct is what it's called. And I typically don't try to isolate it. It's hard to isolate.
Okay.
As is, oddly enough, the hepatic portal vein.
Okay.
And I used to do a lot of work on the liver, and for whatever reason, these pigs, they're just so hard to see the hepatic portal. So I never asked that either.
Okay.
If this is the duodenum, then you can see this kind of diffuse mass right there. What is that?
The pancreas.
That is the pancreas right there, okay? And then if we go down, like right here, this is that's the spiral colon, or the large intestine equivalent.
Can we
in
call that the
pigs.
spiral colon?
You
Is that
can,
okay?
you can,
Okay.
or just tell me it's the large intestine, that's all right. And then this is the first proximal most portion of the small intestine,
Okay.
called
The cecum?
cecum. And if that's the cecum, then that part of the intestine that connects, if I can find it, that connects to it, right there,
The ileum?
that would be the ileum,
Okay.
right there. So we know that this portion is the ileum. The other thing about the small intestine, you can see this double layer of the peritoneum that comes off from the wall and wraps around the small intestine,
Mesentery.
creating the mesentery.
Mesentery.
And you can see blood vessels that are projecting out, and these would be part or branches of the superior mesenteric artery.
Okay.
Then, of course, if we move this out of the way, you can see the abdominal aorta right here. On this one, you can see the renal artery coming off the abdominal aorta, feeding blood into
yeah.
the kidney, and you can also see the renal vein draining blood back into the vena cava, which lies generally to the right of the abdominal aorta. You always see it positioned right there, okay, in these pigs.
Would you call that the
Posterior.
Posterior.
Posterior. Now,
Okay.
if this were human, then it would be the inferior vena cava.
Okay, so this is the anterior
Yeah, that would be
posterior?
the,
Okay.
well, the anterior would always lie on top of the heart,
Okay,
okay? So that would be anterior, and then posterior would be there.
okay,
But you notice, you can see part of the posterior vena cava here,
okay,
and then it repositions more central within the thoracic cavity.
Okay.
Right there, okay? And I think I pointed out the diaphragm, right?
Yeah.
That membrane. So we've seen all
Are
this.
you gonna ask anything about the visceral and parietal pleura?
I could.
Okay.
So, if you look at the lungs here, you can see that thin membrane that's covering the surface. That would be the visceral
Visceral.
pleura right there.
Okay,
And then the parietal pleura would be that membrane.
okay,
Okay? Of course, we've talked about the spleen, the kidneys. What is this tube coming off the kidneys?
the ureter?
Ureter. And if you look at where it's going, if you kind of give it a pull, you can see it going right up into this structure. So we know this is the urinary bladder, right?
Okay,
Okay, this is a male, so coming on the posterior side of the urinary bladder,
vas deferens?
the vas deferens, one from either side, and then you have to feed blood to the testes, and that is through this vessel,
Testicular
which is a
artery.
testicular artery. Here would be a testis laid out right here,
Okay,
and I think it's better on this side, so you can see the testis, and then what's that mass right beside it?
epididymis?
The epididymis, and then this whole structure that you see here is the spermatic cord,
Okay,
okay? The point where it penetrates through the pelvic cavity wall, right there, would be the inguinal canal. So that would be the inguinal canal right there.
okay,
Got it?
got it.
And I think that's pretty much all
And
you
is
can
this the
see on this.
considered the scrotum?
No, the scrotum would be this.
Oh,
This
okay.
sac. This is where the testes would normally sit.
Okay,
And unfortunately, I don't think, let's see, there's the other testis.
and you're not gonna ask
I'm
about
not
the
sure with
penis, because
that.
it's hard to
Yeah,
determine
and
where it is.
I think what happened is they cut the penis out. here.
Okay.
This is probably
Yeah,
the
we were
remnant of
looking for
it,
it.
right there. That's probably the remnant of it.
Okay,
And if you go down here a little bit further, I'm surprised. They didn't quite go down far enough, but you can see the bulbourethral glands.
okay,
That would be, they're actually fairly good size in the pigs, but they're on either side of the bulb of the penis. That would be at the base of the penis right there. But they've actually cut it off, unfortunately. Okay.
Okay.
Any questions about all this, though?
Which one, what is this again? That right there?
That's, they call it just the colon. And so this is carrying what feces out to the outside of the body.
Okay.
And
that's
for
it?
whatever reason, they don't refer to it as the rectum. So,
Okay.
That's it for
Yeah.
the male?
and that would be it for the male.